our first speaker, Birdie Meyer. Birdie is an RN with a master's degree in psychology and counseling. She is past president for Postpartum Support International. She currently serves on PSI's President's Advisory Council and the ICEA, International Childbirth Education Association, PAC. She is also the certification director for PSI. Birdie is a Perinatal Mood Disorders international trainer and speaks frequently to communities, nursing schools, grand rounds, and conferences. Birdie specializes in the recognition and treatment of pregnancy and postpartum mood and anxiety disorders. Birdie is highlighted as a PMD expert in PSI's DVD that is shown around the world, Healthy Mom, Happy Family, Understanding Pregnancy and Postpartum Mood and Anxiety Disorders. So Birdie, you are a treasure to the state of Indiana, and I'm really delighted that you could be here today with us. So welcome.
Thank you. I'm going to share my screen, right?
Yep.
Okay, remind me, Lisa, you have to tell me exactly when I need to be done talking.
I will prompt you. If you want to allow a couple of questions, I will give you a few minutes before 10:15.
Okay, yeah, you don't need to prompt me. I really watch time very closely. I just want to know my absolute deadline.
Yep.
So be done by 11:45, and does that allow time for questions?
If you want to allow time for questions, I would say stop closer to 9:40.
Okay, good deal. Let's go. So my challenge right now is to tell you everything I want to tell you and that I know in 1 hour, basically. But let me, Lisa just introduced me and said, but here it is. I am currently the certification director, and I'll talk about that just for a second. I retired from Indiana University Health. IU Health has 15 hospitals statewide. And I started a perinatal mood disorder program in 1997 and ran that for 25 years. The current coordinator that took my place is Tracy McGinnis. So what people say to me is, I thought you retired. To which my answer is, I retired from the hospital, but I didn't retire from this field or from everything else that I'm doing. So anyway, Lisa already said all this. I want everyone to know, you know how on social media we say trigger warning. This entire presentation is trigger warning. So when we know that 1 in 5 to 7 women have a perinatal mood disorder, I know that in my audience, and 1 in 10 men, that my audience is made up of some people who have had it. And it may trigger you. It may bring up feelings as you listen to me. So just know that and talk to someone if you need to afterwards. It is the vision of PSI that hold on, because I got to get this panel out of my way. That every woman and family worldwide will have access to information, social support, and informed professional care to deal with mental health issues related to childbearing. PSI promotes this vision through advocacy and collaboration and by educating and training the professional community and the public. We have local volunteers in every state and in over 40 countries. I'm one of the volunteer coordinators for the state of Indiana, and that just means that I keep resources and I know where people are, and I've been doing this since 2000. So you also have, all of you, no matter where you are, have your own local support coordinators for PSI who keep track of resources. We have many resources for your clients to connect with volunteer coordinators who will then connect them with those who are trained, and make sure if you're trained that your local support coordinator knows that. You can also get on PSI's directory where people can find you. I like to always say this, that sometimes when you get on Psychology Today, you might find someone who says, I specialize in postpartum depression or perinatal mood disorders, or I frequently treat that, but they've never had any training. And so with PSI's directory, you really must have minimum training to be listed on our directory. And I'll tell you about those trainings throughout this if you haven't already had them. We have online support groups. We have 18 groups a week, and that has quadrupled since COVID. We used to have about 4 or 5 a week. We have educational DVDs that you can find either to buy on DVD or download on Vimeo, and we do have professional trainings. I want to acknowledge diversity. If we were in person, I miss being in person, but this is the first slide we always start with. Please acknowledge the diversity in this group. Be respectful of all voices, opinions, and experiences, and hope to learn from one another. Be aware of our own biases and assumptions. Honor the differences for how parenthood and family are defined. Recognize the limitations represented in the white heteronormative research literature. So I just want to call that out up front. That is most of the literature. And we do have an ever-changing landscape to increase inclusivity in research and practice. What are the needs of childbearing women? This is the ideal. They would have a companion or advocate to provide support during pregnancy, birth, and the first year postpartum. Supportive professionals who are knowledgeable about mental health. Boy, that would be wonderful if all professionals that crossed paths with women and their families had some knowledge about mental health and how to treat it. The companion and advocate there, women do have that with doulas, but not everybody has a doula or can afford a doula, but yay doulas. Having a time and a place to talk about their pregnancy, birth, and continuing postpartum experience. Why do we care about a perinatal mood disorder? Because it's the #1 medical complication related to childbearing. The illness is detectable, and it's an opportunity to help women with prior undiagnosed mental illness or those at risk for continued mental illness. Over the years in this field, I've met so many people who don't know their diagnosis. And if you don't know yours, I hope that you know it before we're done this morning. We cannot pretend, very few of us, in fact, I'm not sure it's even possible. None of us have a clean background. We all inherited what we inherited. And so we have to stop pretending that we don't have something and wishing away whatever diagnosis we do have, some more complicated than others, but know your own diagnosis. Too many times what professionals do is, or even non-professionals, many people, I've heard my friends say this, well, really, I have nothing against people being on antidepressants or being on medications, but I don't know, it just feels like a weakness to me. Ever said that yourself? That really is said a lot. And when you really look deep at that, it's like, well, in a way, I do believe in emotional illness, but on the other hand, I think I can just run more or do more, meditation and I'm going to be okay. Why do we care about a perinatal mood disorder? Because there are tragic consequences: relationship problems, splitting up, divorce, disability, unemployment, child neglect and abuse, developmental delays, behavioral problems, infanticide, homicide, and suicide. I actually just got an email this week from someone who has lost a family member to suicide because of a perinatal mood disorder. Suicide is one of the 3 leading causes of maternal death, and yet we're still not acknowledging a perinatal mood disorder or talking about it much. Let's look at what everybody knows. The term postpartum depression. Perinatal mood and anxiety disorders covers depression and anxiety can occur anytime during pregnancy or the first year postpartum. Some research even takes it out 2 years. It is a new term that replaces that narrow definition of postpartum depression. Now, keep in mind, and that's okay, and in fact, I use the term postpartum depression when people say what I do. Because if I say perinatal mood and anxiety disorders, most people say, what? So back in the day when I used to travel all over and do trainings in person, um, my Uber driver would ask me what I was in town for. And if I would say, I learned real fast, if I say I'm teaching on perinatal mood disorders, what's that? So then I would say postpartum depression. And it's always funny because an Uber driver always says this, oh yeah, that's a real thing, isn't it? So, you know, people that write for magazines or people that are doing an article, they always say postpartum depression. So it's okay. What's the prevalence? About 80% of us get the baby blues in the first couple weeks after baby arrives. At least 1 in 7 mothers experience serious depression or anxiety during pregnancy or postpartum. 1 to 2 out of 1,000 will have psychosis. So it's more rare, but it happens. Don't forget that. 1 to 2 in 1,000. And with the IU health system, just in Indianapolis, probably all 3 hospitals that delivered probably 6,000 to 7,000 a year. And I saw 1 to 2 in 1,000 with psychosis. 1 in 10 fathers experience postpartum depression. So here's the prevalence that you'll see from ACOG. 1 of 7 and 1 out of 10 men. They can, William said in 2015, not only was I accepting some tough personal stuff, but I was just in a funk. Mostly, I felt like I was not a good mom. They do not discriminate. They can impact any of us, and money and socioeconomic status are not protective. When we use the word postpartum depression, so keep this in mind, it means it's only in the postpartum period and it's only depression. It means I don't love my baby or want to kill my baby. It's all about crying. Andrea Yates in Houston, Texas, drowned her 5 children in 2001, and that's a case that really kind of turned around the field with people really acknowledging, oh my gosh, could something like that happen? But the problem is when you say postpartum depression, I think if you say, if I have an audience in person and I'm saying, what do you think postpartum depression is? And this would be someone with no background. They would say, it means you want to kill, or it means, you know, that woman who drowned her 5 kids. So what happens is something like Andrea Yates, that and many other things have happened since then. And when it is on the news, it is said, and they think it is postpartum depression. They think it has to do with postpartum depression. And so that's what happens is the word gets out as that's what it is. Or we have this picture of it's only depression and somebody sitting around crying. It'll go away on its own. I can't tell you how many women came to see me at 6 months postpartum and would say, I thought it was just the blues and it'd go away anytime. Would you please remember when you're teaching about perinatal mood and anxiety disorders, the blues last 2 weeks. The blues last 2 weeks. If it's beyond 2 weeks and you're still not yourself, it's not the blues anymore. That's the most important message for bedside nurses before women and their families are going home. What we teach in OB care provider offices, the blues last 2 weeks. Please, if you're still not yourself after 2 weeks, give us a call. Please get help. And people don't wake up and just say, I think I got postpartum depression. They wake up and say, I haven't been myself since the baby was born. Something's not right. Maybe I'll just wait. Maybe this is just the blues. We have to teach the blues last 2 weeks, and also that it's not just depression. It can look many different ways. Anxiety and depression don't happen at all during pregnancy is what it means when we call it postpartum depression. We also have a big issue with looking at, you can treat hypertension, you can treat diabetes, you can treat all my ailments, but we act like this head is not attached to our body. And so when it comes to an emotional illness as opposed to a physical, we suddenly have shame. We don't think a thing about someone staying on blood pressure meds or on insulin during pregnancy, we would never tell them to go off their meds. But we do that with, let's say, a woman who is on an antidepressant and is well controlled for the last 5 years for a panic disorder. And let's say she also has hypertension, she also has diabetes. We wouldn't say to her, hey, you know what, we're going to take you off your blood pressure med. Let's hope you don't have a stroke. But we want you to be natural during this pregnancy. And we wouldn't say to her, we're going to take you off your insulin. Let's get that pancreas to kick in a little better. We want you to be natural. We wouldn't say that, but we do say too many times, I'd like you to try to wean off that antidepressant because I'd like you to be natural. What's that about? The other thing is women find out they're pregnant, they take themselves off all their meds, or their mom tells them to go off, or the OB care provider tells them to go off, or their psychiatric care provider tells them to go off. That's where we still need lots of education. If you haven't noticed, postpartum is the new label. People just say postpartum for postpartum depression. For instance, hope I don't get postpartum. My sister had postpartum real bad. You will notice that. I did have a reporter writing an article say to me, Birdie, what's the difference between postpartum and postpartum psychosis? And so took me 5 minutes to explain there has to be a word after the word postpartum. Postpartum is the time period from delivery through the first year. That's the postpartum period. But you know what? Just get used to it. You'll understand it when someone says that to you this week. Postpartum. What are the myths of motherhood? We have myths about getting pregnant. It's going to be either really easy or really hard, lots of things around that. 50% of pregnancies are unplanned. We have myths. Keep that in mind. 50% of pregnancies unplanned. We have myths about becoming a mother, about being pregnant, about labor and delivery. That's really our entire focus, right? Is labor and delivery. We have myths about breastfeeding. We have myths baby's going to sleep all the time. And those of you, and you know who you are, that are perfectionists and have your life all together and everything in order. Once you have a baby, it doesn't stay in order anymore. And that trying to still be that superwoman and spouse and mother and keeping it all together is very, it's just overwhelming. This is my own sweet daughter and her husband. And this is an example of 50% of pregnancies are unplanned. She became pregnant at 4 months postpartum. So this is an older picture, but she's a very busy mama. She's got 2 babies, 1 year apart, both born in May. And when I go to help, I always say to my friends when I get back home and I'm exhausted, they never stop. They're now 1.5 and 2.5. Myths, happy all the time. We have myths about the couple. It's going to draw us closer together. And God help those couples who say, let's have a baby to draw us closer together. Selective memory, those are people around who say, I think my baby slept all night long at day 5. I wonder why your baby's not sleeping all night. That's selective memory. You don't remember. And our media images. Everybody has a sweet little baby bump and skinny legs. And believe me, that is not what I looked like. And again, Beyonce with pregnancy with her twins. We have this just beautiful, beautified kind of picture. And not everybody feels lovely and beautiful during pregnancy. Other myths: that all pregnancies are wanted, that all pregnancies end in a live baby. All pregnancy means love in the relationship. All pregnancy means a healthy baby. All pregnancy means fulfillment. So let's look at entering motherhood quickly. There it is, right? Just sitting and cooing at your baby, smiling at each other. And these are beautiful pictures, right? But that isn't what it's like all the time. But that's that picture we have of motherhood. And in fact, all of our pictures are, if you think about, these are posed, beautiful pictures. And by the way, I use friends and family as my pictures. So other than that woman with the white dress on up there at the top holding her baby, that's some picture I got off of media. But the others are people I know. And I love to grab these just lovely, happy, posed pictures, because that's the image we have before we have our first baby, that it's going to be like playing house. When my daughter got home with her first baby, she sent me a text the first day home, and it just said this: everything is new. Think about that. Everything is new. Everything's new. You know nothing. Also, women, we are really awful about being strong and independent and saying, we're fine, we got this, I'm the strong one, I'm the one that takes care of everybody else. But it really does take a village to raise a child. And so it's really hard. You have to give women permission to ask for help, to accept help. In our lives, we have seasons of giving and seasons of receiving. And as a new parent, you're in the season of receiving. And you don't realize that, again, when you are pregnant with your first, you don't realize how much your life's about to change. And so you just think, we'll be fine. But the truth is, we have to give permission. Yes, you have given before, you'll give again, but right now, please know that you're in the season of receiving help. Let others help you. Ask for help. Accept it. This is not a weakness. In other cultures and countries, women are helped, other women gather around, help them, and there's 30 to 40 days of a lying in period and people helping, and other women take care of other children, do their laundry, cook. And what do we do here in Western society? We just, like, 4 days postpartum, we're doing our own laundry. Actually, we even have some of our cultures here in Indiana, like the Amish community, they do gather around and help a new mother. And all around, even if you think about our Latter-day Saints or Mormon communities, they gather around and helps. And many of our faith communities will have like a meal train or whatever. So tap into those and help women and their families tap into that. When I'm pregnant, it's all about me. I have little awareness of how much life's about to change. When you are pregnant, your estrogen and progesterone are as high as they're going to be. When you deliver, they crash down. Up come oxytocin and prolactin, brings in the love hormone. The mothering hormone brings in your milk. We go to prenatal classes, whether in person or online at this point. We're reading books. We're watching YouTubes on deliveries, because that's all we think about. I used to teach childbirth ed, and really what's most important is, okay, now pushing and breathing and what it's going to be like. And when I would teach the sections of the postpartum sections and talking about that and showing those beautiful mesh panties, that you're going to wear, and that big, huge pad for the first few days, just like, but really, they're not paying attention to me in the postpartum period. And then teaching how to change a diaper on a plastic doll in that class, talking about preparing for all this and breastfeeding. But we don't really know when we're pregnant. Like, you just want to say, you don't know how much your life's going to change. And actually, people will say, why didn't you tell us this? And I always say, we did. You couldn't hear it. You just really couldn't hear it. And then we have this moment, right? And these, again, are family members. This moment that you planned for. But so many women will say to me, I was in the delivery room holding my fragile new baby, a human being that I'm now in charge of. And I thought, uh-oh, what do I do now? One woman told me that when they got out on the interstate to go home from the hospital, she said to her husband, go back to the hospital. And he said, did we forget something? And she said, no, we don't know what we're doing. I can't believe we're going home with the baby and don't have a clue. And he said, they're not going to take us back. And she started crying and said, they have to. So that's how it feels to many, many people. I know as a postpartum nurse back in the day, women would say as I was wheeling them out, you're going home with me, right? The baby gets here, and now the focus is on the baby. And sometimes if the mom has the nerve, she says, what about me? What about me? Now it's all about the baby forming an attachment. And can I remind you that not everyone falls madly in love right away? You don't post that on Facebook, do you? Hey, you guys, that gushy, madly fallen in love feeling that you told me that I'd have? Well, I don't have it. Do you see anybody posting that on Facebook? No. We're lying on Facebook. Everything's lovely and wonderful all the time. Our marriages are perfect and our life is perfect and all of that. So focus is now on the baby forming an attachment. I am fatigued and sleep deprived, and overnight I lost all my freedom. I don't get to come and go as I please anymore without a car seat, a diaper bag. I don't have a purse anymore. My diaper bag's my purse. No control of my schedule. I don't get to sleep when I want, eat when I want, and I don't have a clue what I'm doing. So my self-esteem plummets. Like, gosh, does everyone else know what they're doing? And I'm the only one that doesn't? Because on Facebook, it looks like everybody has it together. I know many women who quit looking at social media because they felt it made them feel less than, like that I really am not living up to expectations. Hormone changes, birth not gone as expected. I'm learning new skills, things I've never done before, right? We taught them how to change a diaper on a plastic doll. We didn't teach them baby might poop all the way up to the back of the neck, did we? Or how to clean that up when it happens. Role transitions. This is a huge role transition. I am now parent, mom, dad. I have new titles. Us as a couple, if they are coupled, us as a couple are parents now together. It's really daunting to have that new title. And our own dreams and expectations we had. What did it look like to be a parent that we thought? What was the perfect parent? We're facing fears and feelings. We're renegotiating responsibilities. Who's going to do this laundry? Who's making dinner? Who's dropping off at daycare? Who's picking up? All these things you've never done before. And just rallying together as a couple. Or being alone and single and figuring out how you're going to have this work. We have to rely on support systems, and some people have them and some people don't. I don't know what I'm doing. I'm establishing feeding, and I'm physically and emotionally healing from labor and delivery. So you don't think about birth should be this lovely time. We don't think losses, but like I said, lots of freedom and also lots of your old identity. Never again. I've heard couples say, I miss us. It'll never be us again. Loss of control, loss of body image, loss of self-esteem, loss of financial means, and possibly loss of image of your career or career potential. This is what we all think we're going to look like pregnant, one of my beautiful nieces, and there's reality. Reality is that that's what I looked like in the green jumpsuit there. That's what I looked like at 4 weeks postpartum. And you go out to the store real quick and somebody asks you when your baby's due. Let me remind you, you don't ever ask someone about their pregnancy unless they told you they were pregnant, okay? Just don't do it. It's a huge mistake. I've done it. And people have done it to me. So don't do it. Don't ask someone if they're pregnant unless you see crowning, okay? That's about as simple as it gets. Okay, let's look at the many faces. What does perinatal mood and anxiety disorders look like? We're going to look at depression, anxiety, panic, OCD, post-traumatic stress disorder, psychosis, and bipolar. Keep in mind, these disorders can affect us at any time in our lives, but there is a marked increase in prevalence of these during pregnancy and in the postpartum period. And they look different and feel different. So let's say you already had anxiety. It now involves a baby. So it feels different, looks different. There was a study of 10,000 women published in 2013. This is the biggest study that we've had on perinatal mood and anxiety disorders with 10,000 women, Catherine Wisner, reproductive psychiatrist, and others. 21% had postpartum depression is what came out of this study. And 26% of the episodes began before pregnancy. So they already had something. 33% of episodes and 40% of the episodes began during the postpartum period. I was going to say, this is where you're going to get where you hear us say 1 in 5 to 7 women. So basically, 1 in 7 women develop a perinatal mood disorder during pregnancy, 1 in 7 in the first 3 months. But in that first year postpartum, 1 in 5 women will develop a perinatal mood disorder. So that's where you hear the 1 in 5 to 7, and you see the 21%. 68% of those diagnoses was depression. Along with it, look who always hangs out with depression, anxiety. 66% of the women had comorbid anxiety along with their depression. And in fact, in my practice for over 25 years, many times the presenting factor was anxiety. And that shocks women because they didn't think, they watched for depression and crying, because that's how we call it, postpartum depression. They didn't realize it was going to be anxiety or irritability. 22% of women were diagnosed with bipolar disorder and 19% endorse thoughts of harming themselves. So just some stats: 40% resume medication when they stopped it. Most are undetected and undertreated, and 50 to 75% will relapse after they stop their medication when pregnant. Let's look at the blues. The blues are tearfulness, labile, reactivity. Predominant mood is happiness. It peaks 3 to 5 days after delivery. It's present in 50 to 80% of women in diverse cultures. The blues is not a diagnosis. Crying, feeling overwhelmed, being uncertain, and it's due to hormone changes. It's due to that crashing in the hormones. It does not last more than 2 days to 2 weeks. They are fatigued, of course, and sleep deprived. Let's look at depression, just what you know it is: sadness, crying, unexplained physical complaints, headache, backache, stomach ache, possible suicidal thoughts, appetite changes. Typically with depression, we're overeating, junk food, sugar, chocolate. Sleep disturbances, typically with depression, oversleeping and still exhausted. Poor concentration, focus, irritability, and anger. I've had women say, I didn't have depression, I didn't have anxiety. I was mean as a snake. I was screaming at my toddler, screaming at my spouse, screaming in traffic, screamed at my mother. One woman said, I've never yelled at my mother. Irritability and anger gets overlooked. We don't realize what we have. Hopeless, helpless. I will never be the same again. Oh my gosh, I can't live like this one more day. And the guilt and shame. And I would hear this: Birdie, I should not be in your office. I have a beautiful, healthy baby, a wonderful spouse, a beautiful home. I shouldn't be here. This is awful that I'm here. What is wrong with me? I am so overwhelmed. If I'd known it was going to be this hard, I wouldn't have had a baby. If I'd known it was going to be this hard, we would have waited 5 years. Like, you think you're going to be smarter in 5 years. Some people don't fall madly in love. Some women are unable to even take care of themselves, self-care or family, take shower, or even function. Loss of interest, joy, or pleasure in usual activities. That's anhedonia. Things I used to love, be interested in, suddenly I don't care about any of it. I used to knit, I don't want to knit. I used to enjoy painting, I don't want to paint. I used to love to go out to dinner, I don't want to go out to dinner. Anxiety goes with depression. I feel isolated right now during COVID. Think about the losses of having a baby during COVID, the pregnancy during COVID, the postpartum, not getting to have who you wanted at the delivery, not getting to have your doula, not getting to have your photographer. You get one person. And even for a while there, and I don't think we have any places left, they wouldn't let anyone come in. So many women birthed alone. Now they're at home and they can't have people come over and help because everybody's quarantining or it's risky. So boy, feeling isolated. This just doesn't feel like me. Again, remember, they may not describe it as depression or anxiety. Mood swings, a sense of worthlessness. Anxiety and depression hang out together. Okay, we looked at depression. Let's look at anxiety. Agitated, inability to sit still, excessive concern about baby's health or her own health. Just worry, worry, worry. On high alert. Typically with anxiety, cannot eat. The thought of food makes them sick, can't swallow, maybe even vomiting every day in the shower. These women are losing 20, 30 pounds in 2 to 3 weeks. And everybody's like, look at you getting your figure back. If you see that, she's probably anxious and can't eat. Or as a new mama, we can't figure out when to eat. We're like, I don't know how you have the time. We have to teach that. And that's another lecture. Sleep disturbances. Typically with anxiety, I can't fall asleep. I can't stay asleep. I can't go back to sleep. Constant worry, racing thoughts, short of breath, heart palpitations. Then I go into full-blown panic disorder symptoms. Extreme anxiety. They will describe it as, now I'm short of breath, my heart's pounding out of my chest. They might get chest pain. They will describe a smothering, choking feeling around here. They'll talk about their lips go numb, their face go numb, their hands go numb. They might even pass out. They end up in emergency department, right? Thinking they're having a heart attack or something horrible is going on. And they're told, no, this is postpartum anxiety or this is postpartum anxiety disorder. The three greatest fears. Once I've had a panic attack, I panic I'm going to have another. But this is how you'll hear a panic attack described. The three greatest fears: fear of dying, fear of going crazy, fear of losing control. They would actually say after a panic attack, I thought I was dying. I felt like I was going crazy. I was totally out of control. You'll hear those words. Okay, depression, anxiety, panic. Let's look at OCD. You know who you are, okay? It's okay. We all got something. Classic symptoms of OCD: cleaning, checking, counting, ordering. So those who are the cleaners, kind of germophobia. Now you really don't touch someone's baby without asking. Can I just say that? Don't touch somebody's baby. They don't want you coming up and grabbing their little hands or grabbing their little feet or rubbing them on the head. Honestly, I've had women tell me after she touched my baby, in my mind, that baby was contaminated. I couldn't wait to get away from her. I took all the baby's clothes off and I wiped her down and I threw her clothes, in the laundry. Also excessive cleaning. House has to be even cleaner. I've known people that vacuum and mop every single day trying to keep the house perfect for this new baby. So they ramp up with what they already had. Checking, rechecking. Is the house locked? Did I turn off my coffee pot? Is the baby breathing? Some women can't even sleep because they're checking so often on baby. Some of you have counting things in fours, things in sixes, things, numbers, just numbers thing. Ordering things in a certain order. Orange juice always goes on the right-hand side in the fridge on the second shelf. And when you don't put it back, I say, hey, how come you didn't put the orange juice back where it belongs? See, because I decided where it belongs. Also, I can't let you help me clean, or I can't let you help me do laundry because you don't fold the towels right. You know what I'm saying? I actually redo when someone does my dishwasher. I go and sneak in before I run it and change it around because I know exactly how to load the dishwasher, and I don't know why everybody else doesn't know how to do it right. Okay, the other way that OCD looks. I clearly saw my daughter gray and dead under the water. I couldn't give her baths or take her swimming or put her anywhere near a body of water. What kind of mother thinks these things? My daughter would have been better off without me. OCD, intrusive thoughts. This is the most misunderstood diagnosis of all. They are intrusive, repetitive thoughts, usually of harm coming to baby. They come with tremendous guilt and shame. Women are horrified. Oh, and men, partners, and dads can have intrusive thoughts also with a new baby, especially if they already had a history of intrusive thoughts. History of intrusive thoughts, some people, of course, will say, oh, yeah, I've always had those, but they didn't involve a baby. They are horrified by the thoughts. Now they become hypervigilant, and parents engage in behaviors to avoid harm or minimize triggers. So most common, let me tell you common triggers. Heights. I get near the top of the stairs and I imagine, what if I drop the baby? We all have that. But what happens is, with intrusive thoughts, we have an image, a picture, a movie playing in our head, a story we just keep telling, and this is going to happen, and this is going to happen. So I get to the top of the stairs and I imagine I throw my baby down the stairs. I see that. I see that image. I have that thought. I might even see it playing out in my head. So common triggers: heights, banisters. So what does she do? She sits on her behind and bounces down the stairs so she won't fall. She won't go near a banister. She won't go near anything that's high up, or heights. Water, another trigger. You saw in the previous slide about bathing the baby. You might see images of drowning baby drowning, or me doing it. Don't want to drive over a bridge. Don't want to be anywhere near a body of water. So avoiding water. Sharp objects, knives, scissors, those are really horrendous images and pictures. Sometimes very violent images, pictures, stories. And imagine, that you're in the kitchen cutting a tomato and you suddenly look over at your sweet baby and think, what if I accidentally slipped and what kind of mom has a thought like that? Other images I want you to know about: traffic. For one, you've never had a baby in the back seat, so now traffic and driving with the baby in the back seat is just, some women just cannot drive. And men, honestly, men and partners, same thing. But the worst then, I think of all of it, there's awful ones. I've heard every thought there is, but also could be sexual thoughts of actually sexually abusing baby, and they come out of nowhere. We have to educate mom and partner and dad that thought does not equal action. It's a thought. It's not a fact. You are not going to do that. Common question I get is, what if I totally lose it and I actually do those things? They are horrified by the thoughts. Okay, let me just go back. When I say that's the most misunderstood, sometimes you imagine if you tell that to the wrong person that isn't trained in perinatal mood disorders. Women have had Child Protective Services called on them. They've had the police called on them. I've had women that told their OB care provider, and the OB care provider's office called police and had them picked up and taken to emergency department just from telling intrusive thoughts. So let's keep spreading the word about intrusive thoughts. In fact, one of my favorite colleagues who's written more books than I can count, probably like 10 or 11, but they're all amazing books. That's Karen Kleiman out of Pennsylvania. And she has the Postpartum Stress Center. She wrote a book called Dropping the Baby and Other Scary Thoughts, if you want to read about it. I wouldn't suggest it to your clients until they're way down the path. But there's also one that I'm recommending to moms right now just to normalize it, and it's called Good Moms Have Scary Thoughts. And it's not only about intrusive thoughts, but about the fact that it's like little cartoon characters, the book. And it says, like, you'll say to the mom, how are you doing? And she'll say, fine. But then a bubble above her head says, I should have never done this. I'm a horrible mother. I think I've made a huge mistake. So it shows what we're all really thinking. And so some of it's about intrusive thoughts too. So we need to know that this is very common. PTSD. When Ariana was born, I tore badly, and in the days that followed, I developed an infection. I started having terrible dreams about being chased and raped by men with knives. I was exhausted, but I began to fear falling asleep. The dream images then came during the day, triggering grief and sobbing. PTSD is an anxiety disorder after a terrifying event, and it's in the eye of the beholder. Cheryl Beck, one of our nurse researchers, wrote an article in 2004. I recommend you all read it. She interviewed several women who had had a traumatic birth. It's in the eye of the beholder means don't tell me I didn't have a traumatic birth. It's my perception what was traumatic. PTSD, I have intrusive re-experiencing of the traumatic event. I feel isolated, emotional numbing, hyperarousal, hypervigilance, and avoiding. This is also a great resource, tabs.org.nz. It's out in New Zealand. So imagine, if you will, someone having a traumatic birth. And if we were in person, and honestly longer, I would give you an example of one of my clients with a traumatic birth. But I want you to imagine either you may have had it, or you know people who've had a really traumatic birth. And I'll kind of go over the different ways. But Cheryl Beck found, when she interviewed women with traumatic births, here's the 4 themes she found. Perception, the first theme is perception, lack of caring. I felt abandoned. I felt stripped of all my dignity. Lack of support and reassurance. You did things to my body without asking. Women actually in this first theme have told me they felt raped and they felt violated. Poor communication. They felt invisible. Imagine an emergent situation in the delivery room. All the medical personnel are all, do this, grab this. Sometimes we forget that there's a mom there and a partner there who don't know what's going on, and we're just doing what we need to do to keep a healthy mom and a healthy baby. And many times they aren't being told what's happening. Now, if they have a doula, the doula is saying, here's what's going on, baby is fine. Here's what they're doing now. They're putting on the vacuum extractor, or we're getting you into a C-section right away. Baby's heart rate just fell. But without that person, without that doula telling you what's going on, or the nurse in the room, or the OB care provider, if someone doesn't remember to tell them what's going on, they're saying, women have told me over and over, I ask, is my baby okay? And no one would answer me. I heard them talking in hushed tones over me. I heard this, I heard that, but no one would tell me what was going on. I saw the looks on their faces. Third theme, feeling powerless, betray of trust. You betrayed my trust. You didn't protect me from what happened to me. And in the end, stage or theme 4, did you really have to do all that to me? Was that necessary? Sometimes we need to start to debrief right in that delivery room after baby's born and everything's okay. Whew, any questions for me from your delivery? Now, don't assume they're traumatized. They might not be. I'm always surprised sometimes when someone has a really traumatic delivery and they're not traumatized. So don't put that on them, but just say, any questions? You do want to pass on labor and delivery, pass on to the postpartum nurse. It was a pretty traumatic delivery. Here's what happened. So postpartum, when you're doing teaching, like, hey, any questions about your delivery? You want to start to open that up. But I have found, and research shows, that many women won't come for help till about 3 months after they're having nightmare and start to relive it and play that over and over, that delivery that they had. And then they want to talk about it. They do avoid aftercare. Many times there is an impaired mother-infant bonding. Many times there's PTSD in the partner who witnessed the birth. I had one dad say to me, we had this beautiful birth, and then I looked over and all I saw was bright red blood and clots coming out of my wife. And I said, she's going to die. So he still had his own flashbacks. Many partners have flashbacks from watching the birthing person experience traumatic birth. Sexual dysfunction can happen after, not only from just fear of having sex, but with a traumatic vaginal delivery especially, could have lots of stitches, lots of pain. Always refer to a women's pelvic floor physical therapist. They do wonders. They will avoid future pregnancies. There's exacerbation of feelings and fear in future pregnancies, and especially traumatic birth or emergent C-sections may choose to do C-section in the future. Up to 34% of moms report a traumatic birth. Up to 9% actually meet the criteria for PTSD, and 18% show high levels of postpartum PTSD symptoms. Remember, 1 in 3 to 4 women have been sexually abused. So when you have someone coming, this is a great training and a great book. There's a 2-day training called When Survivors Give Birth by Penny Simpkin and Phyllis Klaus. Also, there's a book that you can read, When Survivors Give Birth. Remember, these women are coming in and their body remembers. They may have dissociated in the past, not even remember much about it, but when we start touching them, put our hands inside of them, touching their breasts, it flashes back. I had one woman who came, wanted a home birth, ends up with an emergency C-section, and when they took her in the OR, they pulled her arms out to the side and started to gently tie down her wrists for get ready for the C-section, and she immediately flashed back to a time as a child when she was held down in that position, things done to her without her consent, and she just started blood-curdling screaming. No one knew what was going on, including her partner, and they had to give her a general thing. And she did want to debrief, and I got called to her room because she couldn't quit crying and hollering, and she hollered and screamed and cried and told me about all of this for an hour and a half. There's fear of the unknown when they've been sexually abused, molested, or raped. And you think about, if 1 in 3 to 4 moms have been sexually abused and 1 in 5 to 6 of a traumatic birth, and sexual abuse both being present in someone, I'm just saying, always remember to send to therapists to get through this for healing. Risk factors: think about all NICU parents might have PTSD. All neonatal complications, lower gestational age, not going home with you. And I know many women who cannot plan a 1-year-old birthday party because they flash back to everything that happens when it comes time to start planning that birthday party, and they avoid all these memories. Traumatic events: emergent C-section, postpartum hemorrhage, premature vacuum extractor. severe preeclampsia, 3rd or 4th degree laceration, hyperemesis gravidarum, that's vomiting nonstop during pregnancy. These women are traumatized. The vomiting stops at delivery, and everybody's like, oh, good, she's going to be fine now. She is traumatized. Women with HG during pregnancy are not believed. They think it's just like, yeah, okay, I had morning sickness. No, 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 no. It's way beyond that. Some women actually die by suicide because they have HG. Some women have decided to terminate pregnancy because of HG. Traumatic vaginal birth, fetal anomaly diagnosis during pregnancy, witnessing partner's birth experience, shoulder dystocia, long labor process, failed pain medication, or poor response to anesthesia. Here are websites for you, and you will get a copy of this PowerPoint in the black and white version. So here's great websites for all of that. And Facebook pages, those almost all have Facebook pages. Each year, an estimated 1,200 women in the US suffer complications during pregnancy or childbirth that prove fatal. 60% tougher complications that are near fatal. Maternal near-miss survivors. There is a closed Facebook page. Remember this for your clients, those who almost die during pregnancy or might still die. Like they had a stroke, they had a heart attack, they nearly did bleed to death. They got preeclampsia, HELP syndrome, end up in intensive care. A maternal near miss is an event where a woman nearly dies due to pregnancy or childbirth-related complications. The events are often unexpected and may leave the survivor isolated and alone. A near miss is a trauma that may likely affect how a person responds to future pregnancies and labor and delivery experiences. I just got contacted by a woman recently who had a postpartum hemorrhage, all kinds of complications, ended up with a hysterectomy. And, you know, dealing with not only her traumatic birth, but dealing with, I can never birth a baby from my own womb again. So dealing with all that. But this is a great close survivor. Racism and health disparities. We're going to hear Dr. Pepra next, who's going to really enlighten you. I've heard her speak several times, so you will be wowed. But I want to make sure that you all know the basics, unless you've been under a rock, to realize we have health disparities, and there are considerable racial disparities in pregnancy-related mortality. Just look at the numbers, and you cannot ignore them about disparities. This is pregnancy-related mortality and how high it is in our Black women. And then infant mortality, same thing. Look at the numbers. It's also high in our American Indian, Alaska Native. So you can see there, just the numbers do not lie. And we have to wake up. Racism and physical health, poor mental health outcomes among communities of color. And they have, you're going to hear again from Dr. Pepra, but chronic exposure to racism on and on and on through the generations. The association of racism and preterm delivery is independent of medical, behavioral, and socioeconomic factors. Psychosis, it was the 7th deadly sin. My children weren't righteous. They stumbled because I was evil. The way I was raising them, they could never be saved. They were doomed to perish in the fires of hell. That is psychosis. 1 to 2 women in 1,000. Andrea Yates did not think, she knew she was drowning her children, but think about this. That's not an intrusive thought. She wasn't horrified by it. She actually was comforted. I need to save my children. The only way I can save them is to baptize them in heaven. She knew she was drowning them, but it needed to be done. Do you understand? It was really an overly protective, motherly thing to do in her distorted mind. Many women that I have seen over the years who had psychosis remember everything that they did and said in a state of psychosis. When they get well, they remember it all. So she has to live with that. And so do many other women with some of the things that happen during a state of psychosis. 1 to 2 women in 1,000 will develop it, and the onset's usually in the first few days, the first few weeks, but it can happen at really any time. I've seen it at 6 months several times. I've even seen it further out. It is delusions, babies possessed by a demon, for instance, hallucination. The one I hear the most is I see my shadows of my dead relatives walking across the room. Insomnia, confusion, rapid mood swings, rapid speech. Waxing and waning is the weirdest thing about postpartum psychosis. I had a woman made an appointment, and when she came in, she said, "Birdie, I made an appointment. I saw your name, and I just want to ask you something. When I stop at a stoplight, I hear a voice that says to me, 'Drive on through, you deserve to die.' Do all new moms have that? Is that the baby blues?" This is what she asked me. And of course, it was a Friday at 4:30 and I had dinner plans. That's when I should never take appointments on Friday afternoon. She was waxing and waning at that moment, perfectly lucid, but was having moments. And what happens is we either don't notice it in our family or partner, or she herself is coming and going. We think, oh, you just need some sleep and you'll be okay. I've had some families say they saw it. They saw lots of symptoms, but they just kept thinking she needed sleep, or they were too embarrassed to come forward, or they didn't know where to seek help. They didn't know what to do. So these moms are not horrified by their thoughts. Now, keep in mind, you have to do a clinical assessment, because there are times that moms with psychosis, it can look like intrusive thoughts, and they might even scare them. But it's the bizarreness of the thought. I'm not righteous, my children, I'm evil, baby's possessed by a demon, his eyes are glowing. It's totally different. So that's hard. I know everybody's going to say, what's the difference? And that's hard, but keep in mind, I saw so much of it. Here's the other: assume it's bipolar until proven otherwise. 86% of women with psychosis met the criteria for bipolar mood disorder. Sometimes that other 14%, we don't know why, some kind of chemical imbalance. But half of stable bipolar patients experience relapse or exacerbated symptoms. When someone has a history of bipolar mood disorders, she should be seen by a psychiatrist all throughout pregnancy and postpartum, because of the high risk of psychosis or exacerbation or relapse. Risk factors: also a history of psychotic episodes or a family history of psychosis episodes or bipolar disorder. Things to note: 20 out of 30 postpartum women with bipolar disorder experienced a psychotic episode. 70% of women with bipolar disorder will relapse in the first 6 months without treatment. When women want to go off their meds, 85% who go off their meds will relapse before the pregnancy's over. That's another statistic by this. This person here does lots of research in this area. Okay, here's a great resource for psychosis. It's on Facebook. They've got a website. Please, if you want to know more about psychosis, get on and read this and send your patients there. Also, remember there's bipolar 1 and bipolar 2. And here's my stat I just said. This researcher, psychiatrist, Figuera, lots of information on bipolar. It gets missed, it gets overlooked, and there's bipolar 1 and 2. The highs aren't as high, the lows aren't as low, gets misdiagnosed as unipolar depression because we don't ask enough questions. It just looks like postpartum depression. Again, great resource, psycheducation.org. Go read information on 1 and 2 and the differences. Sometimes bipolar 2 is called the soft bipolar. Highs aren't as high, lows aren't as low, can sometimes function just fine until they crash and their depression's really bad. Dads, let's look at dads. You see why I said I got to tell you everything I know in 1 hour. What are the consequences with paternal depression? Paternal depression in national studies, the big studies in 2006, 2010, 10% of new fathers scored in the range of moderate to severe depression. These two huge studies showed, both came out the same, 10%. Maternal depression increases the risk of paternal depression. In other words, if mom ain't happy, ain't nobody happy, right? But the number one risk factor for a dad to get postpartum depression is that his partner has postpartum depression, gets it, has it. So now you got two parents depressed. Now, again, remember, we don't have that much research in trans or lesbian couples or gay couples. But I will tell you that in my professional life, I do see partners in lesbian partners. I see many non-birthing parents also getting postpartum depression. Or I've seen where the partners or dads get postpartum depression when the birthing person doesn't have it. So watch for that. With dads, there's this initial high gives way to depression rather than sadness. They likely to be irritable, aggressive, hostile. They check out, they go to their man cave, they play video games. They come home later and later from work. They just don't want to face it. They feel trapped, burdened. Financial responsibility feels overwhelming. Guess what? It's all about baby, and then the birthing person, and then the partner or dad. So they feel out of the circle of attention. No one pays attention. They miss sex. They're also sleep deprived, and they feel isolated and lonely. Their partner's office, their closest friend, and they don't have them. Here's some great resources for dads. So look those up. Postpartumdads.org has lots of info. Postpartum Men or Sad Daddy, I think it's the same website, is for guys with postpartum depression. And Padre Cadre is for dads. Don't forget to ask the partners how they're doing. The partner can be same-sex partners, can also be the grandma helping the teen raise her baby. And I've had grandmas say to me, hey, I think I may have postpartum depression. Well, they're overwhelmed. Same. Who gets it and why? What's the reason? So when we talk about 1 in 5 to 7, why? It's not just about hormones. If you had a previous perinatal mood disorder, or you have a family history, your mom had it, your sister had it, it runs in families. If you yourself had a perinatal mood disorder before, you're likely to get it again. If you had symptoms during pregnancy, you're likely to have postpartum depression and personal or family history of depression, anxiety, all the things I just talked about, depression, anxiety, bipolar disorder, eating disorders, alcoholism, drug addiction, suicide, all those things, personal or family history. And again, most of us don't have a clean history. We have something, but some have more than others. There's the point. If you are a moody teenager, you have really bad PMS, hormonal birth control makes you moody, irritable. Remember, that puts you, these are our risk factors. When I teach this in childbirth ed, and I don't teach anymore, but when I did, I want to be able to give all these risk factors, teach them even in the OB care provider. I want someone to say, oh my gosh, I have a lot of these risk factors. I should watch for this. I have women after I've done my intake, I go over, you have this, you have this, you have this. Look at all your risk factors. I had no idea I had this many risk factors. Childhood sexual abuse. Look at this. It's so common. And even beyond childhood sexual abuse, any sexual abuse, this puts you at higher risk. Long-lasting effects of childhood sexual abuse. So read up on that. I'm not going over all of it with you. More risk factors: history of thyroid imbalance, decreased fertility, fertility medications, really changes moods. Diabetes is the risk factor. Inadequate social support, no one around to help me, or everybody's working full time and no time to help me. Interpersonal violence, financial stress, poverty, recent loss, maybe somebody in their family died, maybe their family pet died, moved into a new place, moved into a bigger apartment, moved across the country. Even higher stress parenting, military, teen, parents of multiples, and single parents. Exacerbating factors: complications in pregnancy, birth, or breastfeeding, teenager or older mom, seasonal affective disorder, which we're all getting ready to go into. I just want to tell you, get your therapy lights out. And perfectionism, high expectations, really higher risk. Pain, lack of sleep, abruptly discontinuing breastfeeding and crashing down your hormones, child care stress, relationship stress, losses, any previous losses, history of childhood sexual abuse. Culture shock, career versus motherhood, unresolved grief or attachment with your mom. Your mom died, your mom's in another country, your mom abandoned you, neglected you, abused you, you and your mom haven't spoken in 10 years, or you argue all the time. When I have a baby, I want my mama to nurture me. And if she's not there for whatever reason, this is overwhelming. Honestly, it's a huge risk factor. Lots of tears. Returning to work. I used to come home from work and prop my feet up and pour a glass of wine and say, whoo, I had a tough day. Now I've got a baby, I've got 2 or 3 kids. When I come home, I start my second shift. I have to feed, bathe, get them in bed, and then finally I have quiet time, and then I stay up too late, and I do it all over again tomorrow. Rule out other causes. Could be thyroid pituitary imbalance, anemia, trauma, side effects of other meds, alcohol or drug use. Remember, this is things they say, not always, I think I got postpartum depression. So really fast, I'm looking at screening. Remember, screening is about educating. We already know the risk factors. We know how to identify. We have treatment. We know we see them in pregnancy and postpartum. We know who's at risk. We know how to screen. We have treatment methods. So come on, let's screen. There's a high prevalence rate, 1 in 5 to 7 women. You can't tell by looking. It increases the rate of detection when we ask, how are you doing emotionally? Not just how are you doing, but how are you doing emotionally? Look here, gestational hypertension affects 6 to 8% of women. Gestational diabetes, 6 to 8% of women. Preeclampsia, 6%. Perinatal mood disorders, 21%. We're screening everyone for hypertension, diabetes, and preeclampsia, aren't we? Yes, we are. Are we screening everyone for a perinatal mood disorder? No, we're not. This is my algorithm in the hospital. And honestly, I know what time it is. And so I'm going to keep going through my slides so I get through them all. EPDS is validated for perinatal use. And we could go on and on because, again, there's lots to do and lots to teach. But I just want you to have an overview today. This is the EPDS, really commonly used and validated. PHQ-9 is probably the other one. Oh, it's not located in the back of your section. That's another training I do, sorry. But you will get these slides. So that's another one, and it's validated for perinatal use, and that's what it looks like, 9 questions. Who should screen? Look at you, the finger's pointing at you. Anyone, everyone who meets with childbearing families should be asking and screening and educating about what to watch for. All of our American Academy Pediatrics, ACOG, and Family Practice all say we should screen. The problem is not everybody's doing it, okay? PSI has recommended these are when we should be screening. It doesn't always occur, but some people are doing it. And remember, screening, it's only a piece of paper. It's only a piece of paper. Don't just hand someone a screen and score it and put that score in their chart and then not tell them one thing about a perinatal mood disorder. Don't do it. You just wasted your time and their time if you're not going to address it. How do we get them better? Medical evaluation, mental health counseling, social support, and new parent classes. We need all those things. And really, social support, in my mind, is the most important because it's a place where they can actually find out they're not the only one and they can be honest. What's our motto in PSI? You're not alone. This affects 1 in 5 to 7 women. You're not to blame. You didn't do something wrong. Look at you. Look at your risk factors. And believe me, with the proper help, you will be well. You will not be like this forever. We have to give them hope because if they don't get hope, that's where suicide comes from. They need good self-care. They need information and education. They need from all places, medical, they might need medication, but inadequate treatment leads to chronic depression and relapse. There are alternative complementary treatments, and you can look at this later, but I like to just talk about the ones that are validated and researched. Some people are doing some weird stuff and you don't know what they're doing. Some people do placenta encapsulation. That's fine with me, but we really don't have research that says that it does what it says it's going to do. So make sure they go to a placenta encapsulation specialist who knows what they're doing. When we don't treat, we've got significant impact on everybody. Untreated, we know that in pregnancy, it leads to postpartum depression and possibly suicide, more drug use, more alcohol use, more cigarette use. When we don't treat, we have outcomes that are not good, low birth weight, preterm birth, gestational, small for gestational age. So know that just not treating. I don't have time to talk about breastfeeding, but no, that's a hard decision. When they need medication, they can take the med, but be educated by a lactation consultant. They can decide not to use meds, but they're exposing baby to untreated. And we need to teach them, fake it till you make it, get to therapy, get to support, or they take the medication and they decide to give formula. It's their choice, okay? Let them decide what they want to do. Of course, if they want help breastfeeding, give them help and support them. Breastfeeding resources for Black moms. You've got this slide. Here's some other things for gender non-conforming and trans chest feeding. Great apps for breastfeeding and medication. And then the last section here is me zipping through telling you resources. I want you to know that you can send people to your local coordinator. We have them in every state in over 40 countries. We have chapters. We're going to do Climb Out of the Darkness right now virtually in Indiana. And so that's going on presently. We have a closed Facebook page you can send your clients to, moderated by 9 of our PSI trained moderators. And on there, women talk to each other about what's going on. And you can join it too and tell me, you'll learn a lot because you'll see what women are really feeling. We have online support groups every single week. We have them for all of these areas: perinatal pregnancy, infant loss, Black Mamas Matter, military, NICU, Spanish, dads, Desi moms, which is South Asian moms, just started. We're adding them constantly. We have also Call for an Expert. We have Call for an Expert once a month with dads, and this is Danny Singley saying dads don't babysit. It's called Parenting. That's also his website, Padre Cadre. Smart Patients Forum. These are places you can send your patients when you say, I don't know where to send them. I don't know what to do with them. Look, you can give them all these resources. For providers, I want you on our online directory so people can find you, but you have to have training first. We have trainings in all kinds of areas. We have a national psychiatric consultation line. Prescribers, if you want information, only prescribers, you can call here. You will get a call back in 24 hours, set up a time to discuss what to do next with your patient. So be the frontline person that starts meds, that does things, but we will help you get through it. Certification, I don't have time to talk about it. Any questions about certification, send me an email or send an email right there. You see to certification@postpartum.net. Materials, posters, PMH discussion tool on our website. We're on social media. We have videos. I wish I had time to show you. We have a program within PSI, Perinatal Mental Health Alliance People of Color. Look at all of our trainings, 2-day trainings, online trainings, frontline provider, advanced psychotherapy and advanced psychopharm. Please look and see where we're doing it. Lots of webinars. Hope to see you. We hope to be in person in New Orleans this year. We'll see. We bridge the gap. Programs around the country, more all the time. There's an updated list, and this is my end. You're not alone. You're not to blame. With help, you will be well. Here's resources for medications in pregnancy and breastfeeding, and that's my last slide. I went over a little.
Thank you, Birdie. As we're making the transition to Dr. Kirsch, there are a couple questions. So as you're kind of closing out, I'm going to ask you.
Okay.
There was a question about when somebody's had a postpartum psychosis, what is the risk of it happening again in a subsequent pregnancy, and can anything be done to prevent it?
Okay, that's a great question. There is and I don't know the exact, it seems like to me, I just read that 50% chance, and it might be a little higher, that if they had a psychosis before, they will get it again. But that is no treatment. So what you would do is honestly, ideally go to someone who is a psychiatric care provider, very well educated in this field, and would be absolutely encouraged not to go off medication, to be watching for it, to know symptoms, to have the partner in on what to watch for, but to watch symptoms. But if they saw a psychiatric care provider trained in this field, knowing how to do it. And again, you can call our consult line to ask those questions, but to be followed all through pregnancy and postpartum and really watch for it. But you can avoid it with good self-care, good treatment. What are we going to do? Actually, protecting sleep is a big, big thing. They have to have sleep because that can throw them into mania and the psychotic episode, but staying on medications and watching the doses, and maybe having to increase doses during pregnancy as blood flow and blood volume increases.
Great. Thank you, Birdie. I want to switch over to Dr. Kirsch, and if at the end of Dr. Kirsch's presentation, we'll have about 5 minutes, and I'd like you to come back on at that point so we can have questions for both you and Dr. Kirsch.
Okay.
Okay, thank you. So if you could close out your screen, and we'll get Dr. Kirsch up there.